Over many years of dental practice, I've examined virtually thousands of patients, and I've seen and I've really had to diagnose almost every possible oral disease. You know, some people think of dentists as only being interested in and knowledgeable about teeth. On the contrary, the dentists of today are the only healthcare professionals who have a thorough knowledge about all of the oral area and the related facial parts of the body. Additionally, they have in-depth knowledge about the relationship of the oral structures to the overall systemic health and disease. The purpose of this brief presentation is to alert you and to educate you about some of the numerous oral disease conditions, ranging from not serious at all to the most serious ones, oral cancer. I assure you that after viewing it, you'll be far more interested in the overall condition of your oral cavity. Additionally, you'll be interested in having your dentist share, during your periodic exams, any potentially negative conditions in your mouth. Well, what is the appearance of a healthy mouth? You're observing the mouth of a healthy young woman who's had a few dental fillings and crowns, as you can see. I'd like you to note some characteristics. Look how pink the gums are. There are no blisters, swellings, lumps, white or red spots, bleeding areas, loose teeth, or other negative conditions. Her palate is pink and normal looking, and her tongue is as normal as it can be. But what about the related external characteristics that dentists observe? As you can see, this healthy, mature woman's face is very symmetrical. Her face and neck have no lumps, swellings, or untreated sores. She has no oral or facial pain, no chronic earaches or muscle soreness. She speaks and chews easily and well, and she does not have bad breath. What are a few examples of the negative conditions dentists see? Gum disease in 35% of the adult population in our country, so-called periodontal disease. There it is. And how about this mouth? Look at the red gums. What are these red gums? They're related to a metal allergy. This patient, I can't tell what that white lesion is. We're going to have to look at it very seriously, as we'll talk about in just a moment. These are benign conditions. It might look gross to you, but look at that. What is a fibroma? You're looking at one. What is a torus mandibularis? You're looking at another one, both benign. How about that? Looks like a canker sore, or is it trauma? We don't know. Your dentist has to tell you. And what about this poor soul? He's been out in the sun way too much. He's been grinding his teeth, and he has oral cancer on his lip. In that brief moment, you've just seen everything from benign conditions to a very serious oral cancer. Let's concentrate on the serious ones for just a few minutes. What are the signs and symptoms of oral cancer? A sore or blister on the lip or in the mouth that doesn't heal. A lump on the lip or in the mouth. White or red patches on the gums, tongue, or lining of the mouth. Unusual bleeding, pain, or numbness in the mouth. Oral pain that doesn't go away. A feeling that something is caught in the throat or difficulty in swallowing, hoarseness, chronic sore throat, difficulty or pain when chewing, chronic earaches, difficulty with jaw opening, continued bleeding from the mouth, swelling of the jaw that causes dentures to fit poorly or to become uncomfortable, unexplained weight loss, numbness of a part of the face, tooth loosening, bad breath. Every one of the signs and symptoms previously listed has numerous other potential causes that are not as serious as cancer. Your dentist, he's the one, she's the one, can differentiate among these conditions. Nobody else can very well. Finally, identifying the oral disease condition by observing the various potential causes for the signs and symptoms that are usually present requires a team approach of medical specialists, including dentists, physicians, and dental and medical specialists. Smoking. Cigarette, cigar, or pipe smokers are 6 times more likely than non-smokers to develop oral cancers. Smokeless tobacco users, big in my area. Users of dip, snuff, or chewing tobacco products are 50 times more likely to develop cancers of the cheek, gums, and lining of the lips. Excessive consumption of alcohol. Oral cancers are 6 times more common in drinkers than in non-drinkers. You may not have heard about oral cancer. How frequent is it? Let's look at some of the little-known facts about oral cancer. 36,540 Americans will be diagnosed with cancer of the oral cavity and pharynx over a 12-month period. During the same time, about 7,880 will die of oral cancer. 1 American dies of oral cancer almost every hour. It claims more victims than cervical, melanoma skin cancers, or testicular cancer. There has not been a decline over the last 30 years despite a reduction in smoking, a known causative factor. Why is that? Oral cancer is usually diagnosed far too late for conservative treatment, which causes the following dismal statistics. When diagnosed in the late stages, the 5-year survival rate is only 30%. But when discovered in the early stages, the survival rate can be 80 to 90%. As a prosthodontist, which I am, I have treated many oral cancer patients who have had devastating, disfiguring surgeries, including the necessity for me to make prosthetic replacements of the nose, eyes, upper and lower jaws, and other facial parts. You don't want that. When you attend your dentist for a periodic exam, the dentist will accomplish a brief but thorough oral cancer exam of the mouth, cheeks, tongue, and throat using a normal bright light in the dental treatment room that you've seen many times. Also, the exam usually includes careful looking for any swellings or lumps on the face or neck that may indicate cancerous invasion from the oral cavity. The purpose of the exam is to find any suspicious areas in their early stages before you are even aware of them. Cancer is no respecter of persons or ages. Each of us should be aware of the dangers of oral cancer. Men have more oral cancer than women, and older people have more cancers than younger people. This man just had several facial cancers removed related to overexposure to the sun, as I have had in the past. Because a higher percentage of men smoke or chew tobacco than women, men have a significantly higher incidence of oral cancer than women. And there's a proven link between oral cancer and the human papillomavirus, or HPV, which is largely transmitted through sexual contact. You now know the signs and symptoms of oral cancer. I suggest you take more notice of them in your own body. We noted a few minutes ago that dentists usually accomplish a visual examination for oral cancer. Is there something more than a visual exam? Yes, there are various more in-depth screening methods than visual exams that dentists can use on you. A brush biopsy is used by some dentists to determine abnormal tissue and potential cancer presence. And your dental professional can also shine a light of a specific wavelength on your oral soft tissues to show abnormal changes that could be malignant. Do you personally have any of the signs or symptoms that we've discussed previously? Usually by the time you personally are aware of these conditions, the disease has spread already. A simple screening using one of the techniques just shown can often detect suspicious areas. Your dentist can accomplish these screenings, or your dental hygienist can accomplish these screenings. What if a suspicious area is found? If a suspicious area is detected by visual exam or by one of the more in-depth cancer detection methods, a small piece of tissue is removed and examined under a microscope to see if the suspicious area is benign, non-cancerous, or malignant, cancerous. This procedure is accomplished by some dentists and routinely by surgical dental specialists such as oral and maxillofacial surgeons or periodontists. How is cancer treated? Oral cancer is treated in the same way as many other cancers are treated. That is, with surgery to remove the cancerous growth, followed by radiation therapy and/or chemotherapy, drug treatments, to destroy any remaining disease. However, you don't want to wait so long that you require extensive treatment. Can you prevent oral cancer? Yes. Pretty obviously, don't smoke or use any tobacco products. Drink alcohol only in moderation. If you wear a denture, make sure it is well-fitting and comfortable. And eat a well-balanced diet. Limit your exposure to the sun. Repeated exposure increases the risk of cancer of the lip, especially the lower lip. When in the sun, use UV sun-blocking protective lotions on your skin as well as on your lips. You now have some information about the ability of dentists to detect many forms of oral disease conditions beyond just what you thought before, decayed teeth, and to relate them to your overall health. You also know the signs and symptoms of the most serious oral condition, oral cancer. What should you personally do about it? Periodically, as with any other cancer, look for any suspicious conditions yourself. You've been warned about that for many forms of cancer. Ask your dentist for a thorough, brief, inexpensive oral cancer exam.